Hi, everyone. I have the highly esteemed and dearly beloved Dr. Nasha Winters with us today. We're so excited.
I feel like it's a mirror because I'd say the same thing about you if I was hosting this conversation. So it's beautiful to be here with my friend for all the right reasons. Our paths have been trying to connect for years before they ever did officially. I don't know if you've ever told that story to your tribe.
Actually, I thought of it today. So let me give a little background. So I'm Erin, Holston, Singh, and I found Nasha when I was doing some preventive medical education. I believe is that what Lynn Patrick's group is called?
Yeah.
And I had just had a baby, it couldn't travel, and I was like doing some online training, and I found your work, and I will never forget the slide that's probably up on my screen somewhere right now that I show people all the time about the neuroendocrine system and, you know, the terrain and all the different systems. And then you had some blood work on there that I had never heard of. I think it was VEGF. And I'm like, what's that? And I'm like, this woman like has, you know, she's putting the whole picture together, and she's taken it another step further that into a realm that I definitely want to learn more about. You know, the patients that frustrated me were cancer patients. And so that was back in 2015, 2016. So started following you. It was before your book came out. And then you were like, well, I got a book coming out. And then the book came out and there was like no lab reference ranges in there. And I'm like, so I started consulting. And anyway, long story, lots of water under the bridge over the many years that we're now been implementing this metabolic approach to cancer, this metabolic terrain-centric care. And now I have a staff of 8, and, you know, it's just kind of crazy that how the whole thing is taken off, and never really intended to specifically work with cancer patients. But we have a lot of topics we want to talk about today. And, you know, my passion.
Hold up, sister.
Yeah.
You forgot the most important part of this story.
Oh, what's that?
So she was correct in the way our paths, like, first of all, it's weird that we were both naturopathic doctors in a relatively small community and our paths hadn't really crossed before that online education course. Then the following, then us consulting on her patients, then. But the coolest part was I ended up doing a training that she hosted in her community in Ohio for mistletoe. She gathered together a bunch of doctors and we did a mistletoe training for one weekend. And I went over to her house for lunch or breakfast one of the days. And of course, I don't know, somehow I ended up in her bedroom, which sounds really weird, but she was getting ready to go to some wedding or something. So I was visiting her there while she was getting ready. And I look above her bed and there is a photo. And I'm like, I know that guy. And suddenly the whole story starts to mesh, that our paths were intended to cross, had been for some time. We knew so many people in the same circle, so many levels. Would you please fill in that little gap here? Because that was another moment where we realized our kindred spirits had finally like reunited.
Well, I will never forget, because you stopped in your tracks and I was giving you a tour of the house, by the way. It wasn't like we were just randomly in the bedroom. I'm looking for this picture that I don't know what happened to it. I think I put something else in it, but yeah. You stopped in your tracks, you looked over at me and you said, what's the name of that meditation you said you do? So here we had been practicing the same method that used to be called Sahaj Marg, still called that, but it's morphed into being known as heartfulness to make it more universal. And you and Steve had been practicing when you were in acupuncture school? In Albuquerque?
Naturopathic and acupuncture school in Albuquerque actually started in Arizona. I was still in naturopathic school and moved on with me to New Mexico. And we had a lot of people in common because of your family connections to New Mexico.
Including my sister who lives in Albuquerque.
Yeah, so we probably sat in circle many times.
Right. So I was just like, that is so crazy that, you know, you and Steve have been doing that same system of meditation that is so near and dear to me.
And this, I think, is such a cool, like, it might not seem relevant to people listening right away, but where I want people to listen is that if we get still, if we get quiet, if we get clear, if we get curious, we will start to recognize the interconnectedness of everything. What is that, like Kevin Bacon, 6 degrees of separation? Like, that is the world we live, right? Right. That
quantum degree.
Is. And so it's so beautiful because it's exactly these moments that our illnesses are about being completely disconnected for a variety of reasons, which we'll talk about later. But the very fact that when we get reminded of how truly connected we are, a lot of healing can take place in that space. So I just thought that was a really cool part of our story of how and why we're here, and how the connection of this is you've helped me amplify my methods, my passion and purpose on this planet, just with our fields colliding.
Yes, yes, absolutely.
Mhm.
Very good. Well, there's so many things that we would love to touch on. One of them being with respect to just trying to help people out in the world understand more about this concept of what terrain-centric cancer care is. One of my employees pointed out how kind of bowled over she was when she heard you talk about the fact that you still have tumors. And, you know, you and I have obviously talked many times about the difference between tumors and cancer. And we'd love to just kind of go into that realm a little bit. I'm sure you've talked about it many times before, but.
Well, not quite in this, I think I guess in this environment in this way. And so it's interesting because I think the mindset that I have, and it's been very like integral to who I am for over 31 years now, was I never saw, even at the time of a diagnosis at 19 years old, a terminal diagnosis, I never saw cancer as other. Somehow that didn't line up for me to think of this as like an external invader or an external situation. So
what you're saying is that you never approached your cancer with the typical war mentality that people look at. I've got to kill the cancer. I've got to get ahead of the cancer.
Yeah. Yeah. And weirdly, in my story, because all of us have our very unique stories, but in my personal story, prior to my cancer diagnosis, I didn't even realize how much I didn't know health until many years later. But I also realized, because I had tried to take my own life on multiple occasions prior to my cancer diagnosis, that at first I welcomed the diagnosis because I thought, well, this is a great way to murder myself and check out of this planet. Here's a really great excuse to not face what I really needed to face.
Yeah.
I didn't know that to the depth that I do today because I was 19.
Well, you were programming your body to check out is what.
And had been for some time, right?
Yeah.
But once someone said to me, because I think the other gene that I have is very much the don't tell me what to do. And
right.
So when the medical community literally said, there's nothing we can do for you, you're going to be dead in 3 to 6 months, because I was so sick, they couldn't even implement standard of care. That was sort of like a double dog dare for me, which is if you wanted me to get things done, you double dog dare me. Right. And that's what has put me on this trajectory of the 31 plus years of understanding. And so for me, just so your listeners are clear, and our listeners are clear, I had no expectation, or even that wasn't my goal, to survive. I just got curious. I wanted to understand why a 19, soon to be 20-year-old was diagnosed with end-stage terminal ovarian cancer, and that everyone had missed it. Right. I was more like, what? How does that happen? Because in 1991, that definitely wasn't happening. Unfortunately, we see a lot more of this age range of being afflicted with this, but just for that context. So what I have learned over the 31 years was, because standard of care wasn't an offer for me at that time, and by the time I did get stable enough and far enough out, I had enough resources and understanding to know how to keep adjusting. I wasn't ever opposed to doing standard of care. I kept finding other ways. That's just my journey. That was my story of this. But what I learned along the way is that we have been treating cancer wrong all along. We've been treating it like an external invader. We've been treating it as the other, and we've been doing everything we can to eradicate every last sort of fragment of it, every last cell of it. But here's the reality, you guys. All of us have cancer all the time. And so, and even standard of care says that. They understand that, but yet they don't, it's like they forget that part when they start to move into the kill phase.
Well, I would back up what you're saying even broader when you're saying we've been treating cancer wrong all the time. It's like we've been treating almost everything wrong all the time. As I've been, what I realized one day as I'm a mile up from the Cleveland Clinic, it dawned on me, why is it that there's a brand new cancer building at both university hospitals and the Cleveland Clinic? Why is it the biggest building, biggest, newest, brightest building on the campus? Doesn't that mean that everything else they're doing is funneling into that building because everything else isn't working. So if we back that up and we take it all the way back to the antibiotics that are given when you're in labor in the IV, because you've got a positive beta strep, like when we start killing, when we have this war mentality for even the germs, we start killing the tiniest little beings, the tiniest little parts of ourselves, then we're also killing us. It's just a slower process. And because we are nature and made of nature, and nature is so forgiving, you know, we don't see it. We don't put those dots together until we absolutely have to. But there was something else you said that I wanted to draw attention to. When you said that you didn't even, you know, think about surviving, but what you did was you got curious. And the fact that you got curious, I think, is something we should blow up a little bit in this conversation, because that curiosity, to me, that's tantamount to the concept of awareness.
Yeah.
Awareness building. And what I'm really trying to teach, you know, my staff, the doctors that I mentor, my patients, is it's really more about what happens because you're developing more awareness. So when we talk about a war on, you know, anything, germs, and we talk about a war on cancer, there's the war on drugs, and then there's the war on consciousness even. And, you know, we are trying to help people expand their awareness. And I'm sure you probably want to say something here, but if you just hang in with me for 1 second.
I'm totally following you.
I'm currently reading a book of an old friend of yours, Ralph Metzner. I believe you told me that you met and did some work with, but I'm got a little book club going, and we're reading The Unfolding Self.
Beautiful.
Which, you know, I wish I was a little further along with, but he's even talking about the whole process of, you know, the subtitle of the book is Varieties of Transformative Experience. But the transformative experience, what he's pointing out, is about heightened awareness.
Yeah.
And this is the conclusion that, you know, I've come out of after working with so many patients, and, you know, now so many cancer patients, is that it's the ones who really step into that state and work on themselves and are willing to go to those hard places. That's what really makes the difference. And yes, sometimes people get to us, you know, too late. They're too broken. They've done too many additional therapies that destroy the terrain, the result of the consciousness that goes into the physical body. It's so deteriorated that, like, it's, you know, you can't overcome that. But it's really these folks that are open to expanding their awareness that, like, enables them to shift it. So, you know, I'd love to hear you talk about that a little bit. Any of your experiences, your own experience, or what you witness. I'm sure you have like oodles and oodles of examples.
And I love you, like, all these pieces. There's some, I mean, we could unpack any one of them for hours on end. And so, but I want to round out a couple of things. First of all, it was like the story of that is so beautiful, because it is just that. It's a story. It's like an unfolding and a revealing. And I love that you pulled out a book called The Unfolding Self. I mean, that was a very integral part of my own healing, was that work, is his book, his writings, and his work. What I did some facilitation of some work with him, which we might touch on here in a moment as well. But that being said, one thing I want to reflect that Erin brought up to everybody is, you know, like the sort of war on, like the antibiotic concept. You have to remember that what we're understanding now of cancer is that it is not a genetic disorder. It is a metabolic mitochondrial disorder. And when the metabolic mitochondria are weakened or defunct or not efficient and effective, then the genome becomes vulnerable. So you've got to back that up. We've spent 75, you know, actually 109 years, 1914, going after cancer as a genetic disorder. And yet in 1920, we realized it's actually a metabolic disorder, but we put all of our eggs in that basket. Watson and Crick, you know, went into the DNA helix, you know, moved into that realm. And we kind of just took a wrong turn in Albuquerque at that time. And we're coming full circle now that even some of the biggest promoters of somatic mutation theory / gene theory have come full circle to say, nope, contraire mon frere, it is actually very similar to Pasteur in his deathbed. It's the terrain, people, not the organism, or not the indicator. But I bring this up because what's very important to understand is at that mitochondrial level, we you and me, all of us, have upwards of 10, depending on the studies, 10 to 20% of our biomass, our own mass, is mitochondria. Mitochondria are bacteria. They evolved from bacteria. We have been pouring oodles of antibacterials into our food supply, onto our soils, into our humans. I mean, thank God in some, like, yay, Fleming coming up with penicillin, but also boo, Fleming coming up with penicillin. Like, we overshot the goal or the option there. The same thing with glyphosate. Glyphosate's like a giant antibiotic on the soil. People like Dr. Huber, that you've got to meet this year, he calls things like Roundup, glyphosate, you know, they encourage basically HIV or AIDS of our soil. So extreme depletion of an immune system, of a vital system to the soil. That soil is what feeds our plants, that feeds our animals, that feed us. And anywhere along the way, that has become defunct, that's become damaged, which means 10 to 20% of ourselves are under constant attack by all these modern technologies and modern ways of being on this planet. And we literally have a medical system that takes care of that 10 to 20% damage by giving it more damaging things to our mitochondria. So we're like, oh, you've got sickness because your mitochondria aren't well, but we're going to now give you more drugs. They're going to make those fledgling mitochondria even sicker. Like, it's no wonder 1 in 2 men, 1 in 2.4 women are expected to have cancer in their lifetime, and that over half of the world is diabetic, or that we're dying now of infections that we should never be dying from, right? Or that cardiovascular disease is finally taking a second back row to the primary cause of death, to cancer. Like, these are the things that we aren't, as you mentioned, the big, shiny, bigger buildings popping up everywhere. We have more and more cancer hospitals popping up all over, and we are not changing our overall survival rates one iota. They're basically flatlined. And the biggest changes we've made were in lifestyle modifications, such as smoking cessation programs for lung cancer, which is the #1 cause of death and cancer in the world. So you brought up some super important points for people to understand. It's like getting curious, getting aware starts to help you understand the why. So then you're empowered to know what to do. So I think that's important. And then full circle back around is just down to my own process and what I've learned and what you've learned and your patients have learned, is that if I try to go after every single one of those cancer cells, I am in fact going after every one of your cells. And I'm often causing more harm to the overall terrain than I am. And that most people can end up dying of the treatment versus the tumor themselves. So the goal is to turn this into a manageable disease process that you push back just enough to build up the body to do its job. And then if it starts to be on the move again, push back just enough to build. This is known as the adaptive theory. And today, the way we approach cancer is in the maximum tolerated dose theory. That's kind of our world ethos, right? Like maximum everything, like hit it as hard as you can, throw all the arsenals at it. When in fact, if you push back just a little, it gives room and space to do more. And so I feel like that's been my personal journey, is I've known when to push back and when to just be, and when to push back and when to be. And I've created a level of awareness, as you beautifully mentioned, as have the patients I've worked with and the doctors that I'm working with, to know when to push and when to pull back, when to push and when to pull back. It's like a dance, and it's a very beautiful dance. And it takes some finesse, it takes presence, it takes patience, and it takes curiosity. And those are all things that are pushed out of our current medical system, unfortunately.
Yes, absolutely. I just had a patient reach out to me this week with a test that her dentist did. And the test is basically, I actually am trying to bring it up here on my screen, because I think it really might help bring home this point that we're really trying to get at, that is so pervasive in our society, that's saying, kill, 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 like, well, what do you do if you don't, like, how do you not, I've been sick for 2 weeks. How do I not take the antibiotic? Like, people think that once you're sick for so long that you have to do something to just stop the symptom. And we're always trying to help people understand that You know, the body is always doing the wisest and the smartest and the most capable thing that it can do in that moment. And when you look at the bigger picture and you understand what you're doing and what work is happening to correct something, sometimes the symptom perhaps cannot nor should it be stopped. Like literally, again, right before my employees left the room, we were talking about a cancer patient, a kidney cancer patient who she started getting diarrhea, and she had diarrhea for like probably 4 months. It's like, you know what? Guess what? Like your mucosa all over your body was healing. And in this process, it was just like, sorry, can't deal. And, you know, it stopped eventually. And we, you know, continued to support her gut and support the healing process. And she ended up getting urinary tract, you know, infections too. We call these things outfections because your body is really
That's a good point.
pushing out, you know, what it doesn't eat anymore. But what I thought was really interesting, and I think that this is worth us looking at. So I'm actually going to share this report here. Let me just. So basically, this is can you see this?
Yep. Perfect.
So basically they did a saliva swab and then they found these organisms. And when you look at what each organism is associated with, like there's a common denominator here.
Yep. Huge.
So yes, we all know that periodontal disease is associated with cardiovascular disease, but what I'm really getting at as a common denominator is the metabolic side of this. And the fact that, you know, these organisms, like, okay, you do the dental treatment, how long before these organisms come back? Because you haven't changed the terrain. Like you have to work with the field, and these organisms are popping up because who's to say, you know, you mentioned the mitochondria was once upon a time its own bacteria. We all know it's co-evolved with us with its own DNA, but who's to say that it's not still a bacteria?
Well, and that's, well, it actually is. Remember, we are more bacteria than human.
Right. Yeah. 10% human. So I think people like, my goal in this world is to help people reconcile germ theory with microbiome science, as well as consciousness, because these little buggers, they are responding to every thought, experience, action.
Totally. Yeah.
So take off on that one.
And you know, Erin, it wasn't that long ago when everyone literally poo-pooed, and I'm using that pun purposefully, the idea that your gut or your microbiome had anything to do with anything. And yet Ayurveda, Chinese medicine, homeopathy, anthroposophical medicine, naturopathy, all of these vitalistic medical systems have recognized the importance. I mean, Hippocrates said it best. It's like disease begins in the gut, right? It begins and ends in the gut. And it's like, we didn't quite know what we know today with that, but we all recognized patterns. They didn't have the particulars to them that we have today, but it was only in the last decade that we really started to give some credence to our microbiome, and that people started to recognize, wow, your microbiome is about how you think and feel. It's about your immune system. It's about how you respond to any pharmaceutical, like to any, treatment for your cancer. I mean, those are really good experiences when you actually start to see studies coming out saying those patients who ended up with antibiotics within 6 months of initiating cancer treatment had a much less response to their cancer treatment. So it's like, how are we ignoring this? And yet every day we're ingesting foods, we're drinking water that is loaded with the antibiotics that people are taking. So it goes into your sewer system. And if you're not filtering it out, you're drinking other people's antibiotics. If you're eating any factory farmed animal protein, you're eating antibiotics. If you're eating grains or legumes, even organic today, you're eating an antibiotic, you're eating an herbicide, you're eating glyphosate, which is an antibiotic, and you're dismantling the mucosa of the gut. If you're taking, let's say, a modern day immune therapy today in standard care, the most common side effect of these miracle drugs that everyone talks about, miracle, by the way, means less than 20% of people are responding to them. So that's our miracle. All right. But the craziest part is the number one side effect of these drugs is gastritis and like tearing up of the GI tract. So like your patient dealing with kidney cancer, a lot of those patients, for instance, end up on these immune therapies that turn into these autoimmune gastritis. Right there, hopefully from how this conversation has started, you recognize the idiot cycle we are on, because they're setting that patient up for failure.
Yeah.
And so what you and I try to convey to people is that, in fact, one of your questions, is chemo even right for you? It's not about, is it right for you? Is it at the right time, at the right dose, at the right duration, based on the right testing for you, paired with the right therapies to make it less toxic and more impactful, while you're also then healing the terrain so that that cancer doesn't come back again? Those are the questions that need to be asked that are never asked. It's not about, is chemo good or bad or right or wrong? It's not being done appropriately in the way it's being done today. And it can be done a hell of a lot better. And that's what you and I and 125 other doctors and 30 more in the new cohort are all aiming to do globally, is to change these conversations. And so it's massive.
So you've done so much amazing work of raising awareness and helping people to understand these things. And those of us that are, we always use that horrible war term, in the trenches, those of us that are working one-on-one with patients, and, people are so overwhelmed and they're so unable to kind of take it all in and make sense out of it. But what I'm really finding after all of these years is that I want to be able to help people get to the point. What I really am doing, where I'm successful, is that I'm helping people get to a point where they slow down enough and they're able to listen to their inner uppermost voice, their higher power, their, it's ultimately, it has to be about that. And, this goes back to the whole consciousness conversation and, Ralph Metzner and Carl Jung and Carl Jung's whole idea of individuation. That's really what we're doing. In fact, I found this wonderful quote of Carl Jung's, which basically he said, the opposite of courage is not cowardice. The opposite of courage is conformity.
Interesting.
So think about that. When we actually individuate ourselves, we set a boundary, we separate from our parents, we become who we are, which is an evolution of the previous generation. That is what this is about. And that's what nature wants. Yeah. Nature wants us to evolve because that's what nature is doing.
Exactly.
That's all there is. So
she wants us to be better every next generation.
Right. And we all want that for our children. And so that's really the test. If there's a test here, the test is just continuing to evolve and surrender and let go. And we can't always be in control. So that was a lot, very lofty, a lot of stuff there. But what I'm really getting at is helping people be able to just slow down enough to listen to their inner selves. It's so painful to watch people make destructive choices that we know they're not going to be able to recover from, so this thing about chemotherapy, it's the right dose and the right duration ends up being, you don't even get a choice for the right dose and the right duration in the United States. Most of the time you end up having to do it longer and in a more damaging duration than anybody has the choice to do if you're going to do it at all. Yeah. So it's so sad, because then somebody's stepping into something that's going to, dismantle their microbiome and their blood-brain barrier and potentially drive brain mets. And yet, who am I to tell them this? They're,
Right. Well, and you brought up a few points here that I think are really important, because it isn't, we talk about this a lot in our physician forum, that you are very integral to and bring your wisdom and light to as well. But we talk about the concept of both, not just for the patient, but even the provider, of being careful not to be reactionary. and to be more responsive. And that speaks so much to that stillness and that quietness and that getting very clear. Some people turn to their faith, some people turn to meditation, some people turn to psychedelics, some people turn to therapy. There's a multitude of ways of reaching that awareness that you even talk about. I mean, I even love the subtitle of the book that you keep holding up here is there's like many roads to Rome, if you will. So that's really critical of getting to the point, because when we make decisions in duress, it never pays off. It never pays off for the patient, for the provider, for the loved ones, for the institutions. It just doesn't. It may feel like it in the moment because you're doing something, but doing something can sometimes backfire terribly. And oftentimes especially later in the game, we've seen this over and over. And so the other thing I want people to know is when they make those decisions in duress, there is a signaling system. There is a messaging system in their cells, in their psyche, and their cells at that mitochondrial metabolic level that is in a danger cell response place that is even more hyper reactive, more vulnerable to toxicity, but even more importantly, it sets up like a barrier to receiving whatever that may be, receiving light, receiving prayer, receiving love, receiving nourishment, receiving healing. So even if you're putting the best therapies into that body, it's been chosen perfectly based on your testing, based on your tissue assays, based on your imaging, based on your epigenetics and your genetics, based on your functional medicine tests. If you're putting all the rights, like this is what your body's telling us it needs per this data, and we put it into you and you are revving, you are running from a saber-toothed tiger, that therapy cannot and will not land as desired, because it's almost like you're deflecting it with each and every thought. And so Erin and I've come up against this a lot. So have the patients. We talk about this in our physician forum probably every other week when we're together. Are the patients who are doing everything right and are still sliding down the tubes? And that's the part we can't do for them.
So the signaling, you're talking, I'm assuming, about things like IGF-1, insulin-like growth factor, cortisol, all the other like neuroendocrine sort of dopamine.
And all the hallmarks of cancer, the signaling pathways, the loss of apoptosis, the lot, like those. So it goes to all those specific targets you just described, but also if you look at the hallmarks of cancer, like all the different levers that get pulled to have cancer express itself, those they go haywire.
Well, it's all about the disconnect of the biology and like the not being connected to what is the issue, the fundamental issue that drove the cancer to launch to begin with. I mean, you can have a metabolic disaster and not have cancer.
Exactly.
Like, what is it that's different between somebody who dies of, diabetes and gangrene and that versus somebody who ends up having the shock of the circumstances that flip that switch? I mean, I think I have on our website that, cancer is that part of your consciousness from which you disconnected, because it's generally associated, German new medicine work, it's associated with different organs and different tissues, depending on what the nature of the original kind of primordial for that person conflict is. So
yeah. And you nail it, like the discussions over and over again about disconnect. You've heard that word that has threaded through all of this. And we're at a time on the planet today where we're more connected than ever in our social technology world, but lonelier than ever. We have, in the United States, we have we're backtracking in our longevity. The only country in the world that are actually losing ground in longevity, where other countries are at least stable or improving. Mm-hmm. And what the scientists are calling this is the era of despair. Mm-hmm. And we just came out of a couple of years that just drove that nail in the coffin even harder. Okay. Of even more isolation in the most profound ways imaginable. But ultimately people are turning to suicide or opiates, of which both are lowering our longevity. So our death rates are going up because of despair and ultimately of disconnect. So imagine that on this sort of macro level, that's happening inside of each of us on this micro level, and on this even down to the particular, the particle energetic level of just this blown out disconnect in the world around us. We've gotten so far from nature's rhythms.
Yeah.
Our bodies don't know what to do with it. Our psyches don't know what to do with it. We don't even know how to relate to another human being anymore.
Yeah.
It's incredible to me.
And
it is a dying art of actually being able to step into your own humanity and share it with another.
Yeah. Yeah. I'm so interested to know more about how the work that the Metabolic Terrain Institute of Health is working on those levels and helping the individual practitioners and the different clinics like bring out more of that, these fundamental topics of a person needs to be able to be in contact with themselves before they're able to make some of these smart choices that fundamentally shift the outcomes. Yeah. So is there anything you want to speak to with respect to what you guys are up to?
Yeah. Well, I think while we're in the virtual campus state, before we raise the funds to build this the first and only thus far, because we hope that there will be many following, residential, nonprofit residential integrative oncology hospitals and research institutions. That's what we're shooting to build in Southeast Arizona, with many more to come to follow. So in the interim, we're in our virtual campus, right? Which is all of you guys. So you guys are, just used that word earlier, in the trenches, but in the terrain or in the field.
We're in the field. We're gonna change that. We're out in the field.
Let's change that up there. It's perfect. So how we are doing that is we are assessing, we're helping people first. They start out with this test concept, and that test is to, maybe they're taking a big intake, going through an intake process, taking a questionnaire, maybe running some labs. So now they're seeing themselves outside of themselves on paper or in a laboratory assessment. And somehow that gives some safety or a buffer for people to start to take a look inward. Right? If they're willing to even sit down and fill out that intake form or fill out that questionnaire or have that blood drawn to look at, they've already gotten curious enough. And now it's like, okay, then you start to, this is what we've been trained our colleagues into, is how do you then assess that information? How do you assess that data and show the patient their patterns, reveal the patient's self to the self, right? That's really powerful. Those two steps alone changes everything, because now most of the time, not all the time, but most of the time, people wake up. People start to realize they have to do more. Many of those people will do whatever it takes. Many will want to do whatever it takes, but for whatever reason, have some roadblocks in that way. This is where I think our community as a whole, like even just simply like giving them a book, giving them a questionnaire, the awareness right there starts a catalyst of events. The testing gives more motion. The address of whatever therapies are appropriate from standard of care, integrative care, spiritual care, whatever that is that come into play, help take them to a certain level. But there's always going to be a place they hit. And this is where people like Erin, who has a passion to go bigger and deeper than the superficial, or advocates that are being trained in this who want to go deeper and further, or patients that know there's something there, but they have to do more. That's when we have to look into our bag of tricks that go far above and beyond pharmaceuticals, nutraceuticals, intravenous therapies, hyperthermia, low dose chemo, off-label drugs, hyperbaric oxygen, like the things, the tangibles. So they have to find the non-tangible experts to work with. And those can be people, those can be situations, those can be certain plant-assisted medications. There are a multitude of ways to sort of override that final frontier hurdle that's there. And that's the place where many of our patients can get to the 70, 80, 90 mark of their own healing process, and maybe even stabilize their cancer to an extreme level, but they're constantly like, paddling in the water in the pool, and they're freaked out that every single, what was that? Like they're living in that perpetual state of stress.
Change that fundamental perspective. And
exactly. When you help them overcome, or they help themselves overcome, or God helps them overcome, or plant medicines help them overcome, suddenly there's this calmness and this stillness that takes place that helps them reach that last 10% to 30% even if the cancer is still present in their body, it's no longer doing any harm.
Yeah.
It's a really big thing for people to hear. And I am but one of thousands of people walking this planet who is living very well with cancer. And there are many more of us who are living well with cancer and don't even know it.
Yeah.
And it's those who are so anticipating, this is going to kill me, this is going to kill me, this is going to kill me, what I got to get rid of, I gotta get it. Those are the people that are the hardest to bring to this level. And that's where it sometimes takes a lot more than what any of us have in our toolboxes. So it may take a spiritual awakening in whatever way that may be, whatever their belief systems hold on to.
I really, I was curious about what all you guys, might have had going on. And part of as we mentioned earlier in this conversation, the similarities between us both having been trained as a naturopathic physician is the core root of the word naturopathy, which, nature cure and homeopathy. And my mentor prior to you, ironically, passed from cancer because he didn't understand the metabolic side of things. But he taught me terrain medicine. I mean, he expanded so much of what I knew. And being French, he was not stuck on this idea in homeopathy that you had to use one remedy at a time. And so after 25 years of practicing the way that Gerard Gagnon practiced homeopathy, I have taken what I've been doing with patients, almost every single patient, I put them on a plan that incorporates plant, mineral, and animal homeopathic substances in sequence according to their temperament, their constitution, and what we call diathesis, which has really to do with like how a person gets sick. And, another word we use is miasm in homeopathy, but it's really like your epigenetics and
totally.
And, right. It's like the precursor to epigenetics
exactly.
in homeopathy. But I decided to take this whole thing and kind of like try to brand it a little bit to get it out there, because we have found that I don't even need to see you as a patient and it's effective. And stop being dogmatic and thinking that I've got to take a whole case and I'm going to give you one homeopathic remedy at a time. People don't even know what homeopathy is, nor do they really care. But this, brings it back home to this whole conversation about consciousness, because it's really vibrational medicine and it can help people shift in ways that they didn't even know. In fact, we took other parts of Dr. Gagnon's work and we metamorphosed his brain protocol into something called the OM program, which it means optimal maturation, but it's harkening back to source with vibration and sound of OM. But these are some of the things that, Options is trying to give back to the world that anybody can do. And, just a little story about that, like the mind body temperament balancing program is something that you can go on our website, purchase it for $150. It's a 3-month program that's tailored specific to you. I have a young woman who, her family is like, our biggest cheerleader. So she'd be good with me telling this story, but I treated her about 18 years ago for OCD, obsessive compulsive disorder, when she was about 13 years old. And her mom was just freaking out thinking, oh my God, I don't want to put her on medication. And she did great. The whole family has done the OM program like countless times, and she just had a baby. So she's about, I think she's probably like 30, 31, 32 now. And she just went and like bought the mind body program the other day. Like sometimes she'll make an appointment with me, but she just like went in because she knows she just needs her, we used to call them
calibrate. Yeah.
Her recalibration, and she'll be good because she's worried about her baby.
I love this.
She's worrying about her baby all night long, getting up and looking at the monitor, and she knows if she just resets, she'll be good. So I just wanted to throw that out there because there's other things that people can do before you even like dive in and do something.
Right. Well, and I want to go back because I think some people in some mindsets are going to have like, there's might be a bad taste in their mouth when we talk about energy medicine or homeopathy or this esoteric woo-woo. But I want to remind everybody that we are literally energy beings. We are physics. We are electrons. We are energy. We are light. And so we respond. In fact, photodynamic therapy has been a therapy in treatment of cancer since the 1960s, FDA approved for the crying out loud. Our mitochondria have these little cycles within inside of them that are responsive to light frequencies. So these cytochromes within. So literally, if you're indoors all day in front of a blue screen and you never see the light of day and you don't know if it's a full moon or a new moon and you don't know if the sun's rising or setting, your mitochondria are literally dying.
Yeah.
Right.
Yeah.
So there's like one example. So it sounds esoteric and woo what we're talking about, but you're getting down to like the fundamentals of we are light beings and we are all starving for light. Absolutely. The other coolest thing is there was a really fantastic presentation this year at SIO, Society of Integrative Oncology, which has historically been, frankly, a little too conservative for my taste, right? Yeah. It's like, great. Yes, we know that meditation and yoga and acupuncture are excellent additions for anybody and everybody, not just the cancer place. That is not integrative oncology. Like that falls far short than what integrative oncology actually can be. But you have to start somewhere, right? Lorenzo Cohen got up this year, who is a really well-known researcher at MD Anderson, really well-known and very respected. And he's like, I'm probably going to be thrown under the bus for this one. But he went into the future of medicine is energy medicine. The future of standard of care medicine is moving into this field. So what you're hearing Erin say may for some of you be like, well, that's too woo, or that's not, that doesn't fall under my faith or whatnot. Guess what, folks? Yeah. It doesn't matter what your faith is. You are an electrical light being. And your medicine will be addressing that from standard of care eventually, but you can already be addressing that right now with your day-to-day routines, with watching the sunrise and the sunset, with walking barefoot on the ground, with walking near the ocean to recharge your internal batteries, by actually applying light therapies. And guess what? Homeopathy is a vibration, a light. It's a form of energy therapy. All of these tools have had massive value since the beginning of time. And our best medicine is from nature. Like exactly the sun, the moon, the rhythms, the seasons, the water, the air, the earth, those have always been there for us. And we're doing our darndest to destroy them. And so when we destroy that, even Franklin Delano Roosevelt said, when we destroy our soil, we destroy ourselves. And that's what we've been doing diligently since World War II, and it's caught up to us. This is where we're seeing things. And it takes a lot more Erins in the world to bring in whatever methods and tools are necessary. Some of them are going to be more drawn to your work, Erin, in this energetic space. Some are going to want to and need to start with the diet. Some are going to want to need to start with maybe the off-label drugs. Either way, they're all a pathway towards hope and healing. And so that's what I think you and your team, like and what I love about your team is you all have different areas of expertise and you have different ways of showing up for the patient and you have different ways of understanding things. But at the end of the day, your results are the same. They're all excellent because you're connecting yourselves with the person in front of you.
I love it.
And this is what's
so excited.
It's so spot on because this is how we heal. You can't have a connection with somebody in 7 minutes of average medical visits like that. This is why you can't have the system that we currently run in is not conducive to healing. It is not.
This has been so awesome. I know that we both need to run here, but we're also going to be seeing each other soon as we're reconnecting with the earth and the sun and the moon and the stars. And by the way, you can't destroy the sun and the moon, maybe the earth, but in terms of nature, destroying nature. And, we are nature. So as we get back to connecting with nature, maybe you and I will do another couple little live conversations to throw out there to the world.
Well, my hope is this will engage some folks out of curiosity. We'll come back with questions. We'll want us to dive deeper into certain topics and we'll come back and do this again.
Yeah. Like if you have questions, let us know what your questions are. We'd love to sit down and riff on everybody's questions, right? Have another reason to get together.
Always, always. Thank you. Thank you, Erin, and for everybody over the option world. And I look forward to seeing you in the flesh soon. And thank you everybody who was willing to hang out with us for this last hour.
So, thanks for listening, everybody.
That's everyone. Ciao.
Bye.